It all began in December 2019, in the bustling city of Wuhan, China. Doctors started noticing a strange illness spreading among people, a new kind of pneumonia that didn't respond to normal treatments. Patients were coming in with fever, cough, and difficulty breathing, and many worked or shopped at the Huanan seafood market, which also sold live wild animals. Scientists soon discovered the cause, a new coronavirus, officially named SARS-CoV-2, and the disease it caused became known as COVID-19. Coronaviruses were not new, they were known to cause colds and other illnesses, but this one was different. It was highly contagious, deadly to some, and completely unknown to science. In just a few weeks, the virus spread beyond Wuhan and across China. Air travel and global trade made it easy for the infection to cross borders. By January 2020, cases were reported in countries like Thailand, Japan, South Korea, and the United States. The World Health Organization, WHO, declared a public health emergency of international concern on January 30, 2020, and by March 11, 2020, COVID-19 was officially declared a global pandemic. Airports shut down, cities went quiet, and billions of people around the world entered lockdown, something humanity had never experienced on such a scale before. By mid-2020, the entire world had changed. Streets were empty, schools were closed, and businesses struggled to survive. People wore masks, avoided crowds, and worked from home. Hospitals were overwhelmed with patients, and doctors and nurses became frontline heroes fighting an invisible enemy. In many countries, fear and confusion spread as fast as the virus itself. Supermarkets ran out of essentials, borders were closed, and people began adapting to a new reality, life under lockdown. Social distancing became the norm, and terms like quarantine, PPE, and flattening the curve entered everyday conversation. But in the middle of all this fear, humanity also found hope, through acts of kindness, community spirit, and the tireless efforts of scientists working day and night to find a cure. By late 2020, scientists achieved what was once thought impossible, developing effective vaccines in record time. Companies like Pfizer-BioNTech, Moderna, and AstraZeneca released vaccines that helped people build immunity against the virus. Vaccination campaigns began across the world in 2021, giving people hope that normal life could return. However, global inequality in vaccine access caused new challenges. Many rich nations vaccinated quickly, while poorer countries struggled to get enough doses. At the same time, new variants of the virus, such as Delta and later Omicron, emerged, spreading even faster and causing new waves of infection. The battle was far from over. By the end of 2022, the coronavirus had infected hundreds of millions and caused millions of deaths worldwide. Families lost loved ones, businesses closed, and economies suffered. Mental health issues also rose sharply, as isolation and uncertainty took a heavy toll. But humanity began to recover. Vaccines, improved treatments, and stronger healthcare systems slowly brought the pandemic under control. Countries reopened, schools resumed, and travel returned, cautiously at first, then more freely. The world after the coronavirus is not the same as before. It taught us painful but important lessons about health, science, unity, and the power of human resilience. We learned the importance of hygiene, the value of science, and how quickly misinformation can spread. We also realized how connected the world truly is, that a virus starting in one city can affect every nation on Earth. Today, even though COVID-19 is no longer at its peak, it remains a reminder of how fragile life can be, and how strong humanity can become when it stands together.